I welcome you to today's GV's Café on behalf of the Spice Route Committee. Today's case presentation will be conducted by Dr. S.A. Farahath. He is a registrar in family medicine and an MCG trainee at the College of General Practitioners. He is going to discuss about an ignorant pandemic. After his case presentation, there will be a discussion where you can post your thoughts. On the same time, you can post your questions on the chat box. I'm sure we are going to have a very interesting discussion. So please stay with us until the end. So without further ado, I'll hand over to Dr. S.A. Farahath to start his presentation.
Thank you so much, Dr. Manoj Yenagil. I hope you all can see my presentation, right? Please.
Yeah, we can see.
Thank you, sir. Good evening, everybody. Thank you so much for the Sri Lanka College of General Practitioner and Spice Route to give me this opportunity. Today, in this evening after the practice, we are all tired, but I made this very short, so it won't take much time. Today, I am going to discuss the pandemic. We all know we had a pandemic, COVID-19, but now I am not going to talk about this COVID-19 pandemic. I am going to talk about another pandemic that you all understand before finishing this presentation. So, to describe this pandemic, I would like to tell you a story. That is, 40 years old, wealthy, rich businessman who is married with their 3 children, who had a low back pain, body ache, lethargy for 1 year duration. He had gone several doctors shopping, including orthopedic surgeon and neurosurgeon as well. But his symptom isn't.
Excuse me, Dr. Farahath. Sorry to interrupt. Your audio is a bit unclear.
Hello, how is it now? Dr. Manoj, can you hear me?
Yeah, we can hear, but it's not clear.
Pain sound, like not in the sound, like it's a.
Now, how is it okay now?
Yeah, now it's a bit.
Now it's better, right?
Yeah.
It's better now, yeah.
Right. Okay. Thank you. So today I am going to tell a story of a 40 years old male who had a lower back pain, body ache, lethargy for 1 year duration. He was a young 40 years with a wealthy person who had these symptoms for 1 year duration. So he went for several doctors. Actually, it was a doctor shopping, including orthopedic surgeons and neurosurgeons. But his symptom didn't settle. So he came to me. I thought I also will be one of his doctor shopping. But anyway, I thought to elaborate his symptoms and find out to give him a solution. So you all know I made a good doctor-patient relationship with a good rapport, and I elaborate his history. In his history, he says his main concern was his back pain. He was so impressed because it affects his day-to-day activities and his business as well. So the pain was gradual onset with the dull pain, and there was no much radiation, but sometimes it's radiated to the bottom. It wasn't associated with incontinence or a cerebral anesthesia. So this pain especially aggravated during the sitting and prolonged sitting and weightlifting. And his past medical history was insignificant, and he wasn't any drugs at that time, including steroid. And there was no history of coma, and there was no family history of any similar symptoms, especially ankylosing spondylitis. As I said, he was a businessman with the 3 children, and he doesn't smoke. He was a teetotaler. But his idea and concern that he was scared of the symptoms, and he avoided the social functions and long travel because it aggravated his pain. You know, there are red flags for the low back pain. So I went through all those things. There wasn't any red flag for him, especially past history of malignancies or any steroid use. So then you all know there's a yellow flag as well. This yellow flag says it's about the patient's behaviors towards the illness and how it is affect his psychology. So he has some yellow flag that he was believed that it could be a harmful problem and a serious illness that affect his future. And in the examinations, you all know when we are doing the musculoskeletal examination, we do the look, feel, move, and any special test. When you look his back, there wasn't any abnormalities, and the muscle spasm was there with the tender points, and the movement was normal. And also in the special test, I did the straight leg raise test. It was normal. You all know how to do this. So to see this sciatica, this SLR was normal. And also I did the Sober's test. That is also we do for find out any ankylosing spondylitis. That is also normal. So this 40-year rich businessman married with the 3 children presented with the weak back pain, lethargy, muscle pains for 1 year duration. And he met several doctors, and he was treated with the non-pharmacological, pharmacological, including physiotherapy. So his symptoms and his problem not settled. So what could be the reason? What are the differential diagnoses for this? Any thoughts, my dear colleagues? Yeah, it could be a thyroid dysfunction, mainly the hypothyroidism, or anemia, or depression. But all those basic investigation was normal. So, you know, when we think about the differential diagnosis in back pain, we can divide into the mechanical back pain and pathological back pain. So with this age, with his complaint, it's the mechanical back pain was very common for him. So it could be the hypermobility or any disc problems. And also pathological, we can divide into the inflammatory infections, neoplasms, and any bone disease. So there were nothing for him. And also the blood test that he took already, that was normal. So now, what could be the reason again? Yes, he was labeled as a medically unexplained symptoms. So when we label a patient with the medically unexplained symptoms, we do the psychiatric referral for the cognitive behavior therapy. And if the patient is depressed, starting the antidepressant. That was about to do this plan for this patient. Then what I thought is I have to do some investigations and find out if there is any other problem other than this medically unexplained symptoms. So I did the full blood count that was normal. The ESR was 10, that one was normal. X-ray also normal. And also the MRA that already took, that is also normal. So then I thought that I have heard that the vitamin D is related to, vitamin D deficiency related to several unexplained symptoms, including bone pain, lethargy, weakness, features of depression. So the investigation that he didn't do is vitamin D. So I thought to do this vitamin D level. So the vitamin D level came as 28. My dear friends, the normal range is 30 to 100. So his vitamin D level is low. So why he had a vitamin D deficiency? So now we diagnose this patient with vitamin D deficiency, and the treatment is easy. You all know how to manage. Any textbook says when the patient has the vitamin D deficiency, you have to treat with the vitamin D, that is 50,000 international units weekly for 8 weeks with the calcium. After 8 weeks, the maintenance dose of vitamin D is 1,000 international units per day. So I treated this patient with this vitamin D and calcium. With this, in 1 month, his symptom was almost more than 95% cured. Then I wanted to see what is the relationship with these unexplained symptoms and the vitamin D. Then only I found our interesting heading, that an ignored pandemic. Then I went to search the literature and saw that WHO, World Health Organization, declared as vitamin D is a pandemic, and it's a silent pandemic, and also it's an ignored pandemic. My dear friend, you know, when we talk to the psychiatrist, they say the depressants are more prevalent because vitamin D is more prevalent. Vitamin D is related to the depression. And when you talk to the orthopedic surgeons, they say hip fractures are more common because vitamin D deficiency is more prevalent. When you talk to the cardiologist, they will say ischemic heart disease is related to the vitamin D deficiency, and it may be the cause of increased ischemic heart disease. So what they say is, as primary care physician, family physician, you all have the responsibility to prevent this. So I will take you all to some other slides, how the vitamin D deficiency is prevented by family physicians. Right. Okay, my dear Kelly, I have a question for you all. What is the best time to get vitamin D from sunlight, and how long you have to stay? And if you stay properly, how much of vitamin D you can get it? Anyone from the audience? Yeah, you all know the vitamin D is one of the fat soluble vitamins. We all know from our school time. It is important for the calcium metabolism and bone mineralization. So without vitamin D, only 10% of the calciums are absorbed from the gut in the absence of vitamin D. So vitamin D is necessary for the calcium absorption. You all know how the vitamin D is synthesized. Sunlight, skin, together with liver and kidney. These procedures is we know. And also the answer for this, the suitable time for the sun exposure is morning 10 a.m. to 3 p.m. We all know earlier, early morning sun exposure is suitable for the vitamin D synthesis. But now they have found it that strong sunlight, that is 10 a.m. to 3 p.m. is the ideal time for the vitamin D synthesis. And if you expose yourself enough with 20 minutes, the body synthesis 1000 international unit of vitamin D. That is the daily requirement for us. Now, another question, you know which vitamin rich foods, which are egg, milk, and fatty fish. But you know how much vitamin D an egg has? The answer is this. Only the 20% of the vitamin D are available from the egg yolk. But if you stay 20 minutes in the sunlight, you will get 1000 international unit of vitamin D. So this is pathogenesis of vitamin D. That is, vitamin D is necessary for the calcium absorption. You know, our ancestors, they were very strong because the foundation was strong. They were stay in the sunlight, worked in the sunlight, and they had enough vitamin C, enough calcium, and their skeleton was strong. So they were strong. But even though we have everything, we are weak because we are not exposing ourselves into the vitamin D. You know how much of vitamin D coming from the food and how much from the sunlight? Only the 10% of the vitamin D is coming from the food. 90% of the vitamin D coming from the sunlight. So if you are not exposed, before we are getting osteomalacia, before we are getting osteoporosis, before the children get rickets, we will present with the vague symptoms, including features of depressions. So, you know the causes. Mainly the causes are lack of sun exposure. Other causes are very less poor diet, smoking, obesity, and the list is going on. And there is a manifestation of the vitamin D, as I said, the symptoms of muscle aches, pains, and vague symptoms, including all the system, including cardiovascular, respiratory, renal, endocrine, psychiatric, and some cancers. So now, how are you going to diagnose vitamin D deficiency? So very simple test, that vitamin D, 25-hydroxyvitamin D3. If you do this test, the results come with either normal or insufficient or deficient. Anyone know from the audience how much a vitamin D test in a private sector? It is about 14,000. So it is costly. So we cannot do each and every patient's vitamin D. But what we can do is, we can encourage the patients to the sun exposure. Again, I have a question. Who is family physician? We all primary care family physician. Who is family physician? Academy of American Family Physicians says a doctor who practices medicine with the principle of family medicine. So one of the important family medicine principle is preventive care at personal level. Family physician giving preventive health care at a personal level to the patients. So we all have the responsibility in our opportunity health promotion in the consultations. We usually say the patient about the balanced diet, exercise, smoking cessation, and stress reduction and relaxation. But my dear colleague, please add this as well. Tell patient to expose in the sunlight, because vitamin D deficiency are more prevalent. Because of this costly, we are not find this as we thought. And also, you know, even we are stay at home or in office or hospital or in the vehicle. So we are not much exposure. Think about the ladies. Some ladies are stay at home. Some of them are, when they come, even they cover most part of the body. So definitely they will come and say aches and pains. When you talk to the patient, they will have the features of depression. So these people definitely have vitamin D deficiency. So my dear friends, please advise the patient to stay in the sunlight in an appropriate time, appropriate duration. So most of the problems will be sorted out. So this is my take-home message. That is very simple preventive care. So I thought not to present a high-fi presentation, but for the family physician, simple care that is that family physician can do, that is preventive care, that is easily natural sun exposure, that is sort out most of the patient's problem. So these are the main reference. Any questions?
Thank you, Dr. Farahath. It was a very interesting presentation on a very important yet ignored topic. There are several questions in the chat box. First one, whether there's any relationship between vitamin D deficiency and obesity.
Yeah, definitely. I showed that in the slide that vitamin D deficiency is related to some the causes of vitamin D deficiency are lack of sun exposure, poor diet, smoking, obesity, sedentary life, dark skin, medications, especially anticoagulant and corticosteroids. So obesity is one of the causes for the vitamin D deficiency. And also, you know, we are South Asian. We ourselves are one of risk factors. That is, we are dark skin. The synthesis of vitamin D are less comparatively white skin people. So we have inborn risk factors also to be a vitamin D deficiency patient. Yes, Dr. Manoj.
There's another question regarding the treatment regime. One question. Usually, the treatment starts with 200,000 units of vitamin D stat, followed by 100 units daily from the endocrine clinic. What's the correct regime?
Yeah, I searched several articles, including Royal College of General Practitioner and Australian Royal College of General Practitioner, which says in a deficiency patients, you have to treat with the high dose, that is 50,000 international units per week for 8 weeks. That's why now you all can see these medical reps and all coming and introduce that they have the 60,000 international unit tablets. And also it has 5,000, 2,000 and 1,000 international unit as well. Because these high dose is necessary to replace this one. So once you replace for 8 weeks, after that you can maintain with the 1,000 international units. So for the daily normal activities, we have to maintain our vitamin D level in the body is around 60 to 70. For this, we have to treat this patient with this. Initially with the high dose, then go with the 1,000 international unit, because our daily requirement is around 800 to 1,000 international units.
Another question, can we prescribe vitamin D without doing vitamin D levels?
Sorry, Manoj, please.
Can we prescribe vitamin D without doing vitamin D levels?
Yeah, that is the important question, because, you know, the vitamin D level is very costly. So it is 14,000 in the private sector. So everyone is not affordable. So what we can do is we have to judge the patients with our clinical knowledge. But we have to treat this patient not with the high dose. we can go with the 2000 international unit per day for 8-week durations, and we can see the improvement. If the improvement is there, we can continue for another 2 months.
There's another question from the audience. In your presentation, you mentioned that the patient had a medical unexplained symptom. So when there's a clear reason found from the investigations, can we label this as medically unexplained?
No, we cannot label him as a medically unexplained symptoms. So I can remember that in SLMA, a couple of days back, SLMA presentation, Dr. Shane and others described these medically unexplained symptoms. So if there is no any clear diagnosis, all the investigations are normal, then only we can label him as a medically unexplained symptom. But this patient has severe problem with the vitamin D deficiency. So if we treat the patient with vitamin D deficiency, vitamin D, the patient improve. So no need to refer this patient for the psychiatric referral and no need for people behavior therapy. Simple treatment with the vitamin D sort out all these problems.
There's another question. Is there any vitamin D production after applying sun creams? Whether the sun creams affect vitamin D production?
Yeah, that is also a good question. So that says if you initially apply sun cream, the absorptions are less. You have to expose the sunlight for at least 10 minutes. After that, you apply the sunburn cream. But you know, in other countries, the skin cancers are common. So they are scared of exposed sunlight. So they say 10 minutes at least without sunscreen, and after that you can expose to sunlight. But in our country, the skin cancers are comparatively low. So exposing for the 20 minutes in the sunlight not going to make any problem like skin cancer. But definitely applying the skin sunburn cream reduces the synthesis of vitamin D.
Next question. Can't we do LDH levels as an indicator instead of vitamin D levels?
Actually, I don't have that much knowledge on LDH level and vitamin D combination. I'm asking same questions from Dr. Asira. How can we interpret LDH level with the vitamin D?
When there is vitamin D deficiency, they say LDH levels rise.
Right, because you can correlate like this: vitamin D deficiency, then less calcium, bone mineralization increase. So the ALP and LDH may be increased. So that is, in a retrospectively, we can say that vitamin D deficiency. But I didn't find
in the private sector.
Yeah.
In the private sector, they use it sometimes to monitor the progress in the treated patients. That's why yeah.
Okay, thank you very much.
Next question is also related to that medical unexplained symptom topic. Is it somatoform disorder then?
Yeah, somatoform disorders, medically unexplained symptoms have some clinical entities like the somatoform disorders, hypochondriasis, like that. But when there is a clear diagnosis, so that is not come under the medically unexplained disease. So if you read about the somatoform disorder, hypochondriasis, and functional disorders, that has no any medically explained symptoms. That is, they believe. That is psychiatric illness. But is here there is a clear evidence that vitamin D deficiency. Once you treat this patient, the patient is improve. So we cannot label this patient as a medically unexplained symptom.
Next question. Is there a particular time of the day to take vitamin D?
There's no any particular times, even we can take in the morning or in the night, but they say is after the meal with the full stomach, take the vitamin D. With this, the absorption is good.
Is there any risk of skin cancer?
Yeah, that is, I explained that the skin cancer risks are high in a country like Australia. So where they advise limited sun exposure and gradually expose to the sunlight. And once you expose in 10 minutes, after that you put then sun protect screen cream. But here the incidence of skin cancer and sun exposures are comparatively less. I don't think that that will affect for us, exposing us to only 20 minutes post skin cancer.
Next question. What parts of the body should be exposed to sunlight to get the maximum benefit?
Yeah, that is also a good question. So what they say is expose most part of the body, and stay in the sunlight until your skin becomes pink. So it is depends on the people. Where we are in the beach or in a rooftop, it's depend on. But they say the most part of the body should be exposed to get enough vitamin D synthesis.
Next question. Being in a tropical country, why it's more prevalent here in Sri Lanka?
Yeah, that is also a good question, because we as a South Asian is a restrictors for vitamin D deficiency, because we have the brown skin. It has a less efficiency to synthesize the vitamin D. That is one thing. Another thing is we are in the tropical country. We have the sunlight in the most of the month. We are not exposing to the sunlight. We are scared to the sunlight. Even if we go, we use the umbrella, or we stay indoor, going by vehicles and work in office. So even though we are living country in Sri Lanka, we are not exposing ourselves much. That is the very disadvantage. That is what, as we have to start to advise the patient as opportunity health promotions, please use this natural source.
Next question is on vitamin D preparations. There are combined preparations available with calcium and vitamin D. What is good, taken alone or combination?
Yeah, the combination also, I saw that calcium 500 milligram and the vitamin D is 400 milligram. These are this is very low level to treat these patients with vitamin D deficiency. So what we expect is we need a calcium 1000 milligram with the initially 50,000 vitamin D international unit, and the maintenance dose is 1000 international units. But this combination is not enough for the treatment. Or we have to take the calcium separately and vitamin D separately. Otherwise, if the combination is good enough in future, then we can advise the combination.
Next question, is it good to take everyone vitamin D?
Yeah, I met one of EP. He said that the patients coming with the vague symptoms, aches and pains, I treat only with the vitamin D and calcium. Almost all the patients are recovered. So these vitamin C's are more prevalent in our country. But the problem is there is no proper research. The research also expensive. If anyone do the research on this, it will be very good for the patient's care. So probably if you suspect clinically, you better start with the vitamin D and calcium.
Those are the questions in the chat box, and you can directly ask questions. This is a discussion. So, and there's a request to share the presentation. I think we can. We are going to share the recording of this presentation on the YouTube. Spice Root.
Yeah, I
TPS
can do this presentation as well. I will share
Hello,
with the-
Dr. Farahath.
Yes,
Good evening.
Dr.
So
Shen.
thank you for your topic. It's a interesting, very interesting topic, and a good presentation.
Thank you.
I just would like to discuss several queries. Now we find these patients sometimes with many, medically unexplained symptoms can be there. Now with when you are, I'm trying to relate it to vitamin D deficiency. So in what sort of patients should we check vitamin D levels? Because sometimes when you say medically unexplained symptoms, there's a whole, it's a large category. Yeah, sometimes patients with numbness can be there, patients with headache, patients can with sort of palpitations, backache, and various things. So in what sort of patient should you consider if the patient is deficient in vitamin D? Thank you.
Good question, Sir Shane. As you said, you did all the basic investigations and there was no any definite diagnosis. Now you are about to label the patient as a medically unexplained symptoms, and sometimes you may have to refer this patient for the cognitive behavior therapy, and sometimes you may have to start the antidepressants. But please, before doing that, if the patient is affordable, ask the patient to do this. But even if the patient is not affordable, treat the patient with the vitamin D and calcium and see the results in 1 month. If it is improved, that is definitely vitamin D deficiency. When the patients come, almost more than 45 years patients, they are coming and telling these vague symptoms, especially the ladies. They have the vitamin D deficiency definitely because they stay home, and also whenever they go out, they cover the body, and they are not exposing. They are using the umbrella. So without vitamin D, the literature says vitamin D is associated with all sort of disease in all the system. Depression, ischemic heart disease, fracture, renal problem, diabetes, all are associated with vitamin D deficiency. So we know even we not exposing ourselves to the sunlight. So this is also my kind request. Please, my colleagues, we should expose ourselves to the sunlight to get enough vitamin D. So, Shane, I hope that
Thank you.
I have answered you.
Thank you. Thank you.
Thank you, sir. If you all don't have any questions, I have a questions for you all. What is the symptoms of hypervitaminosis of vitamin D? Vitamin D excess or vitamin D toxicity? Anyone?
Constipation?
Yes, constipation possibly. This vitamin D excess or hypervitaminosis of vitamin D is very rare. If you treat the patient, there won't be any toxicity. But sometimes, if it is very excess, there is a symptom of hypercalcemia, like constipation, nausea, vomiting, and sometimes they may present with the renal calculate because of hypercalcemia. But if it is very rare, don't worry, you can treat the patient with vitamin D and calcium.
Dr. Farahath, just one thing. So, so what you are saying is either we can test and treat, or either we could treat and see, isn't it? See if the patient improves.
Yeah, if the patient is affordable, as my patient, he was very rich, so he could afford this. So when I say this, there was no any restriction, he did it. And I found it was low. So I treat the patient and he improved. But when you when the patient is not affordable, what we can do is then we can straightforward treat the patient and review in a 1 month whether the symptoms are improving.
Thank you.
Thank you, sir. Okay, thank you so much for everyone for your kind.
Thank you, Dr. Farahath, for your very interesting presentation. Now it's time for the handing over the certificate. I invite Dr. Gobit Ratnam, the chair of Spice Route Sri Lanka, to hand over the e-certificate to Dr. Farahath.
Yeah, wait. Thank you, Farahath.
Thank you so much, Dr. Gobi.
Thank you, Dr. Farahath, for the very good and excellent presentation. Yeah, so actually this is for the virtual certificate for you, but we will send the printed one in the time being. So actually they're very interesting presentation, very important one. Actually, most of the GPs and family physicians and primary care physicians are missing this our one, even though in the tropical country. So thank you again for your excellent presentation. And meantime, I just be with another one more minute. You can join, and for that one. Actually, today we can invite actually one of the our own member who is there in the Wonka world as a YDM chair, Sangha Randrigoma. Sangha, can you talk for a minute for us? Sangha?
Sorry, Gobit, I didn't hear you. You're suddenly.
Sangha was here.
Can you hear me?
Yeah, sure. Yeah. Yeah, Sangha, go ahead.
Oh, okay, all right. Okay. I didn't know. I suddenly didn't hear you. Sorry. Yeah, and Gobi, thank you very much. And thank you very much, Farahath, for that interesting presentation. I was there from the beginning, and it was very nice. And I think very important topic, the vitamin D deficiency, because we get many patients as family physicians that probable cause could be vitamin D deficiency. And one important thing that you told was not as GPs, people in primary care, that we should not always, test and treat. Empirical treatment will also important, because in the current economic crisis, vitamin D levels are very expensive. So it's very important that if we can always clinically have a judgment and treat them. So I think that is the most important thing, and continuity of care to your patients, because your patient is always with you. And I was thinking the other way as well. Even though you told that hypervitaminosis is less, our people are taking vitamin D without any sort of regulation, without any prescription from the GPs. So this could also be one of the problems in future. vitaminosis or vitamin D. So yes, thank you very much, Gobit, for arranging this session. And I think you can also at this presentation, as Farahath was happy to share it on the WhatsApp group of the GP's Cafe, and also on the YouTube channel of the Spice Route. And as the YDM chair, one who went there from you, I wish you all the best, and I request you to continue the good work in future as well, at least once a month with the GP's Cafe. Thank you very much. Have a good day.
Thank you so much.
Thank you, Shankar. Actually, we are doing once a month at the moment, so we will do actually even we are going to have a even session also. So we will inform in the time. You can join, and I will share the WhatsApp link also in future, so you can join with that. Okay. Thank you all for the joining. Thank you, Farah. Thank you.